Hi, I'm Dr. Jason Goodchild from Premier Dental, and today I'm sitting here with Dr. Troy Schmedding, who is a dentist who practices outside of San Francisco, California. And I wanted to check in on him, see how he's doing, how his practice is doing, and ask him about kind of the things he's doing now to manage and then ultimately plan for when things turn around and people try to get back to normal and dental patients come back to the dental office again. So first, Troy, thanks for being with me today. And just wanted to ask how everything's going for you.
Well, thanks for having me, Jason. Things are good. Certainly a time in history that we will never forget. I like to refer to this as the discomfort of the unknown in the situation that we really don't have a path and direction, and it's scary. It's definitely a scary time for the aspect of health and the aspect of business. So there's definitely some different concepts that are certainly a challenge, no doubt.
Yeah. How are you and your family coping? I mean, I know you're at the office today, and we'll talk about that in a little bit. But family's all good. Everybody's healthy.
Yeah, family's good. It's certainly the homeschooling situation that's going on is a new dynamic in life. And as you cruise social media, you see a lot of fun memes and all that type of stuff that's being out there that are pretty relatively true for the most part. But it's certainly a new dynamic spending that much time with family members.
Yeah, and my son is doing something next door. I hear some noise in the background. It's my son playing Wii and stomping on the
Yeah.
floor and everything. So, but it's so different from state to state. In Pennsylvania, we're effectively shut down from providing any kind of dental services, even emergency services at the time. What's going on in California, and more specifically, how are you doing with your practice?
Well, the Bay Area is pretty much in a lockdown situation in terms of a shelter-in-place isolation policy or whatever they're calling it this time. In terms of the dynamics in the dentistry, we're still available to see emergency patients. So an emergency patient basis is always kind of an interesting question, especially when you deal with patients in relationship to one's emergency versus the next. And so ultimately it is a case-by-case situation. And hopefully, as a dental professional, we're doing our part in the overall beginning of the screening process and making sure we're answering asking the right questions and getting a right answer from the patient in terms of, travel, how they've been feeling, anyone around them have the COVID. But ultimately, yes, I still feel we serve a purpose in the California area for sure in relationship to treating patients. If someone's having a dental emergency, they definitely should be seeing a professional in our avenue rather than going to emergency room. So a lot of weeding process. I think there is some dentists probably not following exactly everything they should be in the area, but that's kind of life. But yes, we can still see emergency-based patients, and I would throw the precaution out is to be very careful about that because if you
Yeah,
are.
we had as we were getting ready to click record for today, you and I were talking about PPE, and of course, in the dental office forever, standard precautions, universal precautions have just been a way of life for us. We were used to
Yeah.
working in dirty environments. We're used to protecting ourselves, our teams, and our patients. But what are the challenges right now for you in maintaining good standard precautions and having the PPE to still treat these emergency patients?
Well, we're certainly, like you said, we've always went by standard universal precautions and all the different type of things that we're extremely used to. So our comfort level is there. I think the question lies as to where are we heading in relationships to our new PPE policies in relationship to masks and that type of stuff. I do have some N95s from actually from a neighbor that had them from a painting party they had, of all things you can believe. So I do have 4 N95 masks that I have in the office that I use when I see the patients. But my precautions are always still going to be the same. We're still going to do exactly what we've done in the past. I think long term, the question is going to lie to is, are we going to need to change how we do things? And to a certain degree, I'm sure that will change. But my biggest concern with the PPEs is certainly when we open back up, what is going to be the supply shortage for dentists? I mean, are we going to be in a situation where we're open for 2 weeks, we're out of PPEs, and we have to shut down again for an extended period of time? So there's definitely some vulnerability in the PPE section, no doubt about it.
Yeah, because you and I had talked, I forget when it was, a few days ago maybe even, about that dental distributors were limiting PPE even if you could get it.
Yeah. Yeah, yeah, they're certainly limiting. In fact, I think there's limits on masks to three boxes per customer. I was just on a website recently looking for the California Dental Association as a supply chain that they refer to their members, and they're not selling any masks at this point. So it's completely shut down in that department.
Yeah, again, I just think about how quickly this whole thing went down. As of maybe a week ago, week and a half ago, I don't want to say business as usual, but we were certainly still seeing patients and kind of doing the things that dentists do. And in the span of, a week, 10 days, even maybe even 2 weeks, it's all come crashing down where, you can't find PPE, limits on what you can practice, and in some states, how you can practice. So in Pennsylvania, they're requiring N95 and negative pressure rooms. Um, I just feel like the how fast this whole thing went down is so incredible.
Yeah, no, I think the speed is just astronomical and how fast or how vulnerable we are as a society to these situations. I mean, it's not no fault to anybody. I'm not sure you can plan for something like this. Um,
No, we
so,
were actually, again, some of the things we were chatting about before we clicked record again was the idea that um, I don't know what your ordering pattern was. Were you doing a 2-week cycle, a 30-day cycle? I don't think dentists were in any way prepared for that kind of eventuality where they couldn't get the supplies they need. I mean, things we order, we get the next day in most cases. So how are you doing your ordering? And what are you doing with your ordering now? I mean, are you complete shutdown, not ordering anything, or just basic essentials like PPE?
So one of the reasons I'm in today is just to get an evaluation of where we are with our PPEs and start to look at, the ordering process itself. I mean, I think I'm going to go online. I'm going to see what I can get. I'm going to try to get as little as quantity as I can, just in the sense that I still, there's still obviously a need for different PPEs out there in the hospital setting and that type of situation. So we got to be a little bit careful. But yeah, I think it's important that you, as a practice owner, go analyze what you have. It's important to know what you have in stock. And yes, to this point, I was, yeah, absolutely. Next day order, right? So no need to ever carry more than 2 weeks of supplies in your office for any reason at all. We were so spoiled by the quick delivery, quick turnaround, the things that we always had just at the push of a button. I mean, it was amazing what we had. But yeah, so that's kind of where we're at right now, just to get an evaluation of the practice itself in terms of the PPEs, because it is a process that's going to happen as we move forward.
Yeah. So what about your team? I think you had mentioned that some are furloughed and you have another person helping you, but I mean, are you going as bare bones as you possibly can?
Yeah, unfortunately, we have to at this particular point go into the bare bones situation. Fortunately, they have the unemployment avenue. They have some nice avenues in terms of relationship to finances with the packages being passed. Hopefully, they're in a good situation. But yeah, so I have one here that's staying on. I'm trying to employ her as much as I can, helping me with those dental emergencies that I need. But yeah, we are definitely a skeleton crew for, like I said before, just that discomfort of the unknown. It's a tough situation for everybody.
Yeah. Well, I wanted to wrap up today by kind of asking you, as a business owner, maybe you want to give me some personal thoughts too. I know that it's tough all around. We're stuck at home, which may be a blessing and a curse, like you
Yeah.
already mentioned. But from the business perspective, what are your 3 things that you're really thinking about now? Top of mind things? Is it business preservation type of steps? Is it cleaning and planning? What are you thinking about now, Troy?
Well, I think now is a really, like you said, it's kind of a double-edged sword in the situation. It's been nice to spend some quality family time. And there is a situation in life where sometimes, if depending on your religious background or what you feel, but it's almost like someone just put the brakes on life to maybe step back for a second and look at really what's important to all of us to a certain degree. So kind of a plus side, because I think staying positive is an important part of this whole thing too, because it's very easy to get wrapped up into, especially if you watch the news all day long, which I can't personally. I've really limited my news intake for a certain period of time. But I think that's important to stay positive. In terms of a business relationship, my biggest concern is my employees. I mean, they're very dedicated, very loyal people. So I need to do everything I can to try to keep them employed and keep them on a livable situation. It's kind of a responsibility I think we all have as practice owners, business owners. But at the same time, it also gives us an opportunity to take a look at our overall aspect of how we're doing business and what's important to us, and looking at that aspect of how we're relating to patients. I think this is an opportune time for you to reconnect with patients, start to reestablish that importance, that level of communication, that commitment to their overall oral health. Because when the dust is settling, we're probably going to be in some form of a recession or another. And it's important that your patients understand and realize that you're still there for them, and understand that maybe you'll have to change how you do things in the office, maybe financially for patients for a little bit. Maybe you have to incorporate a few more different financial avenues for patients, those type of things. So I think there's a lot of deep soul searching that needs to go on within you personally to kind of figure out, where you want to take things, and make sure you have those steps in place. This is a time that you have a spare moment or two, unfortunately, to take a look at different things and maybe drive your practice to a different avenue. But in the meantime, staying positive. It's an important avenue that we all stay positive, because it's a dark time, no doubt about it.
Good thoughts, Troy. Certainly, I think positivity, I know that's tough right now, but positivity is something we all need to focus on. And then remember that there will be a time when we'll be back doing the things that we love to do, and taking care of patients. And I think we're all looking forward to that time. So
Absolutely.
Troy, I can't thank you enough, man. And my plan is, if you're open to it, is to potentially touch base with you in a week or 2 weeks and see how you're doing things, see how things are evolving for you out there in the West Coast, and try and staying in touch. So,
yeah, that would be great. Absolutely. I think it's important that we all communicate, share our feelings, because it's a small profession, and we need to kind of look out for one another for sure. Yeah.
Awesome, Troy. Thanks so much, man.
All right,
Take
buddy.
care, and I'll talk to you soon.
Sounds good, man. Take care.
All right.
Bye-bye.